Hey everyone! Today we'll be discussing oral premalignant lesions. It is a benign morphologically altered tissue that has a greater than normal risk of malignant transformation. This will be a series of videos in which we'll be discussing many of the oral premalignant lesions. But in this video, we'll be specifically talking about leukoplakia. So, leuko means white and plakia means patch. So, leukoplakia is a white patch or plaque which cannot be characterized clinically or pathologically as any other disease. There will be a white patch on the surface of the epithelium, as we can see. It is considered a premalignant or a precancerous lesion. It has thickened surface keratin layer. Let's look at some of the etiological factors which may be associated with leukoplakia. Tobacco is a carcinogen and is responsible for more than 80% of the cases. In some of the cases, alcohol consumption has also been reported. A herbal extract known as Sanguinaria. It is present in toothpastes and mouthwash, but it rarely causes any malignant change. UV light affects the lower lip, causing leukoplakia of the lower lip. We also have some bacterial agents like Treponema pallidum or the Candida albicans. Trauma is a very important factor. Lesions like frictional keratosis. This occurs on the oral mucosa due to the mechanical irritation caused by sharp edges of the tooth or toothbrushing. Now let's look at some of the most common sites where we can find leukoplakia. 70% of these lesions can be found on three main areas: the lip vermilion, the buccal mucosa, and the gingiva. Whereas the lesions on the lip vermilion, flora of the mouth, and the tongue, in more than 90% of the cases, they show dysplastic changes. So to understand leukoplakia better, we're going to go into the detail of dysplasia. It is the presence of abnormal cells within a tissue or an organ. This is an epithelium. We're going to look at the layers of epithelium. Just above the basement membrane, we have the basal layer, and above the basal layer, we have the spinous layer. So there are three types of dysplasia: mild, moderate, and severe. In the mild epithelial dysplasia, the alteration is limited to basal and parabasal layers, whereas in the moderate, it is limited to the mid portion of the spinous layer, whereas in the severe, it is going to go above the midpoint of the spinous layer of the epithelium. Now we're going to look at it diagrammatically. As we can see, the mild is just above the basal layer, whereas the moderate one is going to the mid portion of the spinous layer, whereas the severe is reaching up to the level of the epithelium. There are many clinical types of leukoplakia. First, we're going to look at the thin leukoplakia, also known as early or mild. It is translucent, fissured, or wrinkled. It is also soft with sharply demarcated borders. And it may show dysplasia sometimes. This is the lateral surface of the tongue. It has a white lesion. It blends well into the oral mucosa. And we can also appreciate that it may be flat or it could be slightly elevated in some cases. If the carcinogenic habits are not discontinued by the patient, this lesion is going to progress and become a thick leukoplakia, also known as homogeneous leukoplakia. This is the dorsal surface of the tongue, and it is coated by a thick, fissured white plaque. This means that it has increased keratin, showing hyperkeratosis. There will be mild or moderate dysplasia. Some of these lesions regress or even disappear, but sometimes they progress to granular or nodular leukoplakia by developing surface irregularities. Now we have the verrucous leukoplakia, also known as verruciform leukoplakia. This possesses sharp or blunt wart-like projections. Now, this is going to possess moderate dysplasia, and it may eventually become even worse, and it may change into proliferative verrucous leukoplakia, also known as PVL. Now, PVL is a high-risk lesion. We can frequently see it on the gingiva. It may show dysplasia, and as we can see in this picture, it is an exophytic lesion. Now, how are we going to see this on the microscope? Some histopathological features are hyperkeratosis. This means that the keratin layer has thickened in size. As we can see in this picture, that the keratin layer is almost double the size. We can also appreciate acanthosis. Acanthosis is a thickened spinous layer, as we can appreciate in the diagram. We will also find chronic inflammatory cells, and we will also see features of dysplasia. So now this is a picture of a cell, a typical cell, with the purple part being the nuclei and the surrounding area is the cytoplasm. So in dysplasia, we will see enlarged nuclei and cell size. The nuclei will be prominent and there will be an increased nuclear to cytoplasmic ratio. We will also see an increase in the mitotic activity of the cells. Now, how are we going to diagnose the leukoplakia? The best diagnostic method is to take a biopsy of the most clinically severe area and evaluate it under the microscope and determine the level of dysplasia. Treatment is according to the level of dysplasia. If there is no or mild dysplasia, the patient is advised to discontinue their carcinogenic habits and follow up with their dentist every 6 months to monitor any change. For moderate or severe dysplasia, the best treatment option is surgical excision. We could also do electrocautery. In this, a heated electrode is applied to the lesion to achieve hemostasis of the tissue or destruction of the cells. Cryosurgery is also an option in which extremely cold temperature like liquid nitrogen is used to again stop the tissue advancement. And lastly, we have laser ablation. It can also be used to surgically excise and give clean margins. So, even after complete removal of the lesion, there is a 10 to 35% chance that the lesion may reoccur because the cells, they may spread to the surrounding areas and they may cause the lesion to reoccur. There is an 83% reoccurrence rate for verruciform or granular type. So it is very important that we advise the patient to keep a follow-up appointment with their dentist and get it checked every 6 months to monitor any change. Thank you.